All right, are we on?
It is loading, so give us one more second.
Okay, tell me when I'm good. Is
One new case today, Council.
that right? All right, that's what I'm looking for.
Yep.
Good. Keep it that way.
All right, Counselor, you are good.
Great. So welcome, everyone. We are just a couple minutes after 5 o'clock, and I will call the meeting to order and ask that we do a roll call.
Councillor Romero Worth,
I am here.
Councillor Rivera,
I'm here.
Councillor Villarreal,
Present.
Councillor Garcia,
Here.
Councillor Cassett Sanchez.
Here.
You have a quorum.
Fabulous, thank you. We need to do approval of the agenda, but we need to do a couple of things to the agenda. One, I need to take off item A. Do I do that here? Can I do that now? From the consent agenda, or should I wait for the consent agenda? So we're gonna take off, we're gonna postpone item 6A and wait on that item. And then I would like the committee's permission to move up item 8 to come before the consent agenda. We have two public members who have agreed to join us tonight, and I would like to be very respectful of their time, Ginny Kimball and Dr. Wendy Johnson. So if we could get a motion to approve the agenda with those changes, that'd be great.
Move to approve as amended.
Second.
All right, if we could get a roll call on that, thank you.
Sure. Councillor Villarreal,
Yes.
Councillor Rivera,
Yes.
Councillor Cassett Sanchez,
Yes.
Councillor Garcia,
Yes.
and Councillor Romero Worth.
Yes.
Motion passed.
And just for the, just to be clear, remind me who moved that, Cassett Sanchez, Councilor Cassett Sanchez?
Councillor
you-
Villarreal.
Okay. All right, perfect, just so we're clear. All right, so then we need to go to the approval of the consent agenda. Are there any items that the committee would like to pull?
Just a quick amendment, some amendments for item C.
Okay, any others?
To pull item B.
Okay. And then that means we do not need to approve a consent agenda at this moment because we've pulled everything from it. So we will just move along and we will go to approval of the minutes from the May 6th Quality of Life Committee meeting. Are there changes to the minutes?
Madam Chair, I have a few adjustments.
Okay,
Page 3 of the minutes.
yes.
At the bottom, with the paragraph that starts off with Councilor Villarreal, the second sentence, it says she has been working hard. It should state she and the team have been working really hard, and I appreciate all they're doing.
Okay,
And then on page 10 of the minutes, about middle of the page, it says Councilor Villarreal asked if anyone is using another location for anything. I didn't say that. I said Councilor Villarreal asked if anyone is using another location for food prep. And then further down towards the end, it says Villarreal states the food farms. It should state Councilor Villarreal asked about the local dairies and throwing out milk.
okay.
And those are all adjustments I have. Thank you.
Anybody else have changes to the minutes? Is there a motion to approve these minutes as amended?
Move to approve as amended.
Is there a second?
Second it.
Councilor Villarreal moved and Councilor Garcia seconded. Can we have a roll call, please?
Councillor Villarreal,
Yes.
Councillor Garcia,
Sorry, yes.
Councillor Rivera,
Yes.
Councillor Cassett Sanchez,
Yes.
and Councillor Romero Worth.
Yes.
Motion passed.
So with that, we have approved the minutes. According to our new plan, we are going to go to item number 8. And we have, that item is considerations for opening the city of Santa Fe. I'm delighted to have Jenny Kimball from La Fonda, chair of the board, and on the mayor's, or no, not on the mayor's, on the governor's task force, looking at how, I believe it, your purview is how the hospitality industry reopens in the state. Is that correct?
Yes, we put together the COVID safety practices for the hospitality industry.
Perfect. And then we also have Wendy Johnson, who's the medical director at La Familia Medical Center, to give us a sense of, what kinds of things we need to think about from a public health perspective as we begin to reopen and where we are. And I think it might be beneficial if we hear from Wendy first and then go to Jennifer. Would that be okay?
Sure.
So thank you both for being here, and I'll just turn it over to you all. And I just also want to state, again, for the committee and for the public, we're going to try to keep this meeting in a 2-hour time frame. So just so everybody knows, we could, any one of these topics we could probably spend hours on, and I'm just really trying to get us to be disciplined in how we move through the items on the committee. So with that, I will turn it over to, was there?
Madam Chair, just a point to make. I'll be leaving at latest 6:45 because today's my partner's birthday. So we're gonna have dinner.
Nice. Happy birthday. All right, so Wendy, kick it off for us, please. Dr. Johnson, I should say.
Thanks. Let me share my screen. There you go. Can you see that?
We can.
Okay, awesome. I prepared a little PowerPoint presentation. A lot of this probably you already know. This is from the dashboard, and just start like orienting us where we are in Santa Fe in terms of the epidemic. So far we have this, I pulled this off earlier today, so I guess it's a little outdated, but I guess we have 127 cases today. We added 1 case today, and 3 deaths. And as of yesterday evening, 7,669 tests had been done. And where we stand in comparison to the rest of the state, this is the prevalence rate as of May 18th, yesterday, for, or 2 days ago rather, for all the counties. And we're definitely on the lower half. We're definitely the lowest of all the urban or semi-urban counties in the state, I think. We're a little bit about even with Rio Arriba, and lower than most of the counties around us, 83 per 100,000 cases. And that's, about 3 times lower than the state, which is 285 per 100,000. And then this is some of these, a lot of these slides I got from the Department of Health, different presentations, both the mayor's press conferences and David Grace's presentations he's done to different groups recently, webinars that I've been on. But according to kind of the best estimate, we've probably peaked. You can see, for example, the metro area, Albuquerque area has seemed to, that green line has 2 peaks. We are that really pink bottom line that just scrolls along the bottom. So because our 7-day average has been, below 5 for quite a while. So it's varied since the beginning. So it's hard to say about a peak or trough for us because we've been at that low level the whole time. We are there. The whole state is this blue line that seems to be coming down, hopefully. And then the Northwest also, the McKinley County, San Juan County, also coming down, high numbers of cases. And then what's concerning right now is the Southwest, actually, this blue line, which is, looks like it's maybe peaking, going up. Hard to say what's going on here. but actually has been trending a little bit up, and that's Las Cruces area. And then another good indicator for our region is the rate of spread. So the opening, and I have a slide about this in a minute, but the opening target is for every one person, they pass it on to 1.15 other people, or maybe an easier way to understand that is if 100 people get infected, they pass it on to 115. And so the metro area is 1.07 right now. We're 1.09. A few days before, we were even lower than that at 1.05. And you see, actually, again, the southeast region a little bit higher, and the southwest region 1.17, a little bit higher than the cutoff of that target for reopening. Overall, we're at 1.15 or 1.13, I think now for the state when you average all that together. And then interestingly, the Northwest is really come down from even just a week ago at 1.30 around there to now a couple of weeks ago, I think, to 1.15. So they've done great work really at the Northwest. Even they're still generating a lot of cases, their transmission has really come down. So when we think about reopening, I think the first thing to understand is how COVID is transmitted. And there's a lot of confusion on this. There's a lot of different information in the press. And it's really important to get back to the basics and not to be distracted, I think, about a lot of the very kind of far-fetched possibilities. Because when we're thinking about risk, we want to think about what is the highest risk? What is the most dangerous situations? To understand that, we have to go back to understand how is the virus most commonly transmitted? And it's really this droplet transmission, okay? We hear a lot about aerosols, we hear a lot about contaminated surfaces, but all of that is really on the margins and much less possible, and it's really about the droplet transmission. So in order for this virus to be transmitted, you need, first of all, a vehicle that can hold an adequate number of viral particles to transmit to you. If I have one viral particle on my finger, you know, the chances that one viral particle is going to cause an infection are very low. So you need a critical mass, a critical number. You also need it to go from an infected person's mucus, saliva, to a susceptible person's mucous membranes, the kind of cells that the virus can infect, right? Because if the virus gets on my skin and then I wash my hands, the virus is gone, okay? It's not, even if I have an open cut, you know, it's not going to get, if it gets into my blood, that's not the cell that the virus can infect, okay? It needs to get into my mucous membranes. So we hear a lot about aerosol transmission. Measles is a disease that's transmitted by aerosols. If this disease was transmitted in a significant way by aerosol transmission, we would really see different patterns of transmission. We would see a different kind of R effective, we would see a different kind of contagiousness. So we really do know, even though it's theoretically possible, we hear these things about aerosols traveling 26 feet and all of that. Even though that's theoretically possible, maybe 1 in 100 or 1 in 1,000 times, it's not very likely and it's not very common. It's not like norovirus that lives in surfaces for a long time and you don't need very much of the norovirus to be able to infect you. Because again, we'd see a different pattern of transmission if it was. It's not like hepatitis A that's transmitted through food. Because again, we would see something different. Okay, so it's important to try to sort out the wheat from the chaff, sort out some of the very confusing information we get, and focus on the most dangerous, most common ways of getting infected. We also have to remember principles, I think, when we're thinking about reopening, of harm reduction. So when we think of harm reduction, really family practitioners, primary care docs have been practicing harm reduction for ages. You know, we think about it in terms of substance abuse, we think about it in terms of heroin use. but it really goes farther than that. And on the bottom, I've listed some examples of what harm reduction are. Seatbelts are harm reduction. Wearing helmets when you bike are harm reduction. Having no smoking areas is harm reduction. Wearing condoms is harm reduction. So these are all meant to help us when we are engaged or exposed to risky behavior to reduce our harm from that behavior. We all need to drive. Driving is a risk. How can we lower that risk as far as possible? And it's the same principles when we think of reopening our economy with COVID. We need to have people working. We need to have our economy working, but we need to be as safe as possible while we're doing that. So how can we combine those things? So some principles we want to think about when we think about solutions, harm reduction solutions, they need to be pragmatic because COVID's not going away. We're going to be doing this for the long haul. So it needs to be something that's really possible to do, okay? They need to be humanistic. We need to respect individual rights and decisions, even sometimes when we disagree with them. We need to focus on the greatest harms, and that's why I was talking about that issue around the transmission. We need to figure out what's the highest risk and how can we mitigate that high risk. We need to balance the cost and benefits to the individual and society. We need to understand that my goals are not going to be the same as your goals. So we have to understand that, each individual situation is different. I might have a job that I need to put myself at a higher risk than you do, and I need to figure out how to protect myself differently. I may have a sick mother that I need to care for. I may have a personal situation that is more important to me than some of the other harm reduction principles possibly. And so everybody's going to have a different way of assessing their own risk. And there needs to be room for that in harm reduction. So when we think about what are the highest risk things and what are the lowest risk things, the elements of high risk for COVID are situations where we have a large number of people that are close together, face to face, for a long period of time, inside a closed space, that don't have a mask or hygiene, okay? So when we think about this, this is why the virus has really spread a lot in Navajo Nation, because you have houses where you have all these things, and you have no running water. And so this is exactly the recipe for spreading the virus. The lowest risk situations are a low number of people who can be distant, not face-to-face for a short time, outside instead of inside, and having a mask, proper hygiene, access to soap or hand sanitizer. So when this is from the state again, so the criteria for the public health criteria for opening for the state, we've met of these 4 criteria, we've met 3 of them, where the spread rate has to be 1.15 or less. As I said, we're in Santa Fe 1.09 right now. We have a testing capacity statewide of 5,000 a day. We're almost there. That's the only one we haven't met. We have to have adequate contact tracing and isolation capacity. So this is how long does it take from the time I get a positive test to the time that I can call that person, isolate them, start to quarantine their contacts. And the goal is 80% of those cases will be contacted within 24 hours. And so that has been accomplished. And then the other one is, the last one is our hospitals. What is our hospital capacity in terms of ICU beds occupied? And we have, we want to keep that below 460. It was just 255. And then there's the last one around protective equipment. And that's all good. So when we talk about contact tracing and testing, when we're talking about that in a local context, we have actually seen a really big, I won't call it an explosion, but an expansion of testing just in the last week with the new governor's orders kind of encouraging everybody to get tested. A lot of people are being called back to work. I'm getting a lot of calls by patients saying, oh, my employer wants me to call back, wants me to come back, but wants me to have a negative test before I come back. And so I'm sending people to testing for that. So we're testing more and more asymptomatic folks. We might expect a little bit of a case rate rise as we increase testing. We really haven't seen too much of that in the last week in Santa Fe, but we might expect that. We want to be concerned locally, not only with our capacity for testing, but we want to be concerned with how long does it take to get that test result? Are we informing the primary care providers so that they can help give support to their patients? And are we informing, of course, the folks who are tested very quickly after their results? So we want to be able to test a lot of people and get the results back to both the patients and their primary care providers, if possible, as fast as possible. We want fast, thorough, and complete contact tracing. So the states, what the state is doing, what the state is considering a contact is anybody in the time period where you might have been infectious, which is a complicated thing to figure out, who you have been around without a mask, face to face, for within 6 feet for 3 minutes or longer, or with a mask, face to face, for 10 minutes or longer, again, within 6 feet. So just think about your own life in the last 3 days, 5 days, because there's situations where you might be contact tracing a person's life for 10 days, you know, so all situations are going to be different. But think about your own life in the past 3 days. That's probably a large number of people. And the other thing we want to consider about testing, we want to get our contact tracing capacity as robust as possible. We want also our testing capacity as robust as possible. One measure of that is the number of tests we're doing. Another measure of that is the percent of positive that we're having. And I, as kind of a rough guide, was saying that we'd want our percent of positive be down to 1% positivity rate in Santa Fe. That would be a good indication that we're testing enough people. Well, as of yesterday, we're at 1.6. So that's good. That's really great compared to 4.3% statewide. A little bit about contact tracing. I think, as many of you know, have been working with both the city and the county as kind of an expert advisor around building our own local contact tracing team that can be a collaborative effort between the city and the county. There have been some great people identified to do contact tracing, librarians, other people who have a lot of experience working with the public, lots of bilingual people. And we're working closely with the State Department of Health and the governor's office so that we can all collaborate, but we can have a very intensive local contact tracing effort. Another thing that can support us in contact tracing are the apps. And Google and Apple have announced technology, it's not an app, it's technology that local governments can use to create a local specific app that will tell you, I could put the app on my phone, and then it will track my movements, and it will see who else I've been around, who also has the app, of course, who is also being tracked. The data all stays on my phone. It doesn't go anywhere, okay? But if I'm around somebody that has tested positive 2 or 3 days later, my app will send me a text message, for example. You've been in contact with somebody, or you've been around somebody who tested positive. Please call this number for more information to get tested, whatever. And we could have a local number where people call of our contact tracers that could then give the person information that they need. So far, several European countries, North Dakota, Alabama, and South Carolina, have said they're going to use this technology. It's voluntary, so we can't make people put it on their phones. But if a critical mass of folks get it on their phone, if we promote it, this could be a really powerful tool to help us do contact tracing more effectively. So as we're opening up, there's a lot of considerations, and I can, probably do a whole talk on each one of these bullet points. But there's social and family considerations that we have to consider in the city and county government. We have to consider how we can support folks as we open up in all these very, very different situations. We have large families in small spaces. If somebody's positive, how do we handle that? I mean, as a provider, I'm struggling with how do you counsel people about, you know, where can they stay and how do I self-isolate from other people in my family? In families, we have a mix of some people are going out working, some people who might be vulnerable. We have kids. There's certainly going to be childcare issues that are going to become more and more intense as we start opening more. You know, just because we're opening doesn't mean these mental health and stress issues aren't going to go away. In some ways, they could even get worse because of all these other things going on. We have to make sure people in their family and home situations have access to hand sanitizers and masks. We have to have considerations for vulnerable populations and the homeless, and also be aware, as I know we've all talked about a lot, about the increase in domestic violence when people are can't really get out of the house and are together for long periods of time. And these are still going to be considerations when we open, because vulnerable people still are going to need to be very careful, because you know, not everybody's going to go back to employment right away, and because there's going to be people who are contacts or test positive who are going to need to self-isolate for all those reasons. When we think about considerations in the workplace, we want to make sure that me as a worker, I have access to the adequate PPE I need. We want to make sure that I'm supported to work from home if that's a possibility, that I have the physical space I need to be safe. I was mentioning earlier that a lot of employers are saying, oh, you need to get tested before you can come back to work. Well, I want to make sure that employers really understand what that means. I mean, the test that for the virus only tells me that you don't have the virus today. You know, I'm getting the test 4 days later. So it told me I didn't have the virus 3 days ago. You know, it doesn't tell me anything about today, doesn't tell me anything about next week. So I'm curious as to why employers are doing that, maybe thinking it protects them some liability wise, I'm not sure. Also in terms of sick leave and health benefits, because the quarantining issues are still going to go on. And in terms of business considerations, and I'll hand it over to Jenny to, or stay for questions, whatever, she can address these things. But, you know, how can businesses limit the time that people are spending inside, especially indoors, in their establishment? How can we balance the physical space with the number of workers and the number of patrons a business has? I mean, the governor's already doing that in terms of the restrictions on us, but we're going to have to continue to think about that even when we're, you know, fully open. How can I limit face-to-face contact? Is there a way that we can, you know, and of course there's some businesses that by their nature, they're about face-to-face contact, like restaurants. But is there a way we can mitigate that? And again, restaurants are a big problem because you can't wear masks. Kind of the whole idea is face-to-face. You can be a little distant, but that's about it. Maximizing outdoor service. You know, there've been a lot of creative solutions around closing down streets, opening up more spaces for outdoor dining, that kind of thing. The considerations of businesses having to enforce things like mask requirements, and what that means for different businesses, and the difficult position that really puts, you know, grocery store managers and you know, other kinds of small businesses in when people are belligerent about that, and how to educate the public about that. And then hygiene and disinfecting, you know, that's different for example, a salon or like an acupuncture studio or something like that versus, you know, some other place where people aren't so close together, but like a grocery store. But each business is going to have its own challenges around those things. And that's kind of all I have for that. So I could, well.
So are you, Wendy, would you be, sorry, Dr. Johnson, would you be available to stay for Jenny's presentation? And then maybe, I do have one counselor already raising their hand. Maybe we can take questions for both presentations. Would that be all right with the committee and with our presenters?
Yeah, that's fine.
I'm seeing nods. So let's go ahead and hear about the business side of this.
Okay, that would be great. Thank you for just, if somebody can put my presentation, perfect. So next page, I'm going to basically talk as quick as I can because like Dr. Johnson, I could talk for a long time on each of these, but I'm basically wanted to go over the hospitality sector with you, what we're doing, what we can do, what the challenges are. I want to go over the tourism industry with you. Again, the challenges, what we're trying to do, and some suggestions for small business and local industries. So let me just start out by saying, I think, like Dr. Johnson said, you may have heard most of this, but for instance, the travel-related jobs since COVID, the unemployment rate is 51%. In the Great Depression for travel-related jobs, the unemployment rate was 25%. So the hospitality and travel-related industry has been devastated. I think everybody knows that, but I just want that as to lay that out before the whole presentation about reopening. So if we can go to the next slide and I can walk through, I'm hoping, I'd love to answer any questions, but I hope that this will show you some of the challenges that local businesses have, as well as it may make you feel better as to all of the steps that have already been taken to try to provide a safe environment. In the hotel industry, clearly we have two sets of people we need to keep safe. The first and foremost is our staff, and then secondly would be the guests. And so a lot of the protocols are the same for both, but in terms of trying to support our staff, again, face masks are required. We are not requiring gloves. We have hand sanitizer stations everywhere. One of the things we're having trouble with is we early on embraced the hand sanitizer station that's touchless. And unfortunately, it's the same ones the hospitals have. So we can't get refills for our hand sanitizer. So these are things that are challenges for businesses that spend the money to try to do the right thing, and then they cannot get supplies to continue it. We have safety protocols in writing in the front of the house, the back of the house. I'll show you some examples of it so you can see what we're doing. We have put in an order for some electrostatic sanitizing sprayers. Those are those things you see where if we can take a guest room after a guest has left and spray it, then that will alleviate a lot of the problems right now, because they are back ordered until midsummer. What we're doing is once a guest checks out of the hotel, no one is going into that room for 4 days, not our cleaning staff, anyone. And then after 4 days, we're going in and I'll go through all of the protocols we've done. But one of the things I would recommend for all the local businesses, depending on how many employees, is to identify what I call a COVID czar, somebody in each business that becomes an expert in the standards, the safety measures, and the procedures so that they can train the employees and train the staff. It would be nice on the larger companies like ours to have a department-specific protocols. So we have certain protocols for our front desk staff. We have certain protocols for our housekeeping staff. We have certain protocols for our retail staff. So, and the state, as you know, has just issued protocols for all of the different segments. And so businesses like ours that have many different facets have to comply with all the retail, the hospitality, the office, all of those. And anybody that has an employer, there's an entire section in the state of COVID safety practices for anybody that is an employer. And one of the things we're challenged with is how to publicize that so all of the business know what the procedures are so they can start complying with it. Next page. So this is an example. One of the things that's so important on all these practices is how to communicate them. So this is LaFonda's webpage. All of the businesses should have this on their webpage. We have a COVID update right on the webpage, and what that contains is basically a message to our guests as to what we are doing to protect them, that we are in full compliance with the state. We're in full compliance with the Centers for CDC guidelines for hotels and for the New Mexico Department of Health. It also talks about that our spa is closed per regulations. It talks about we are limited to 25% occupancy during this emergency, that we are complying with that there is a 14-day mandatory quarantine if you've come into the state from another state. And it's an entire page of what we expect our guests who check in and what our staff is doing to keep everybody safe. It is front row and center on our website. The second part of our website talks about the curbside menu, because even though restaurants are closed, one of the things we can still do is serve takeout and delivery. So that pops up, but again, it reinforces in people that may come to Santa Fe, they're not going to be able to sit in a restaurant and eat. They're not going to be able to sit at a bar like they can in other states. And it's on the website front row and center, because we don't want people showing up at our door that are coming from other states that don't wear masks, that can have bars. So part of this is just communicating it up front, being very transparent. The third thing we have on our website is called Peace of Mind. And it's, again, a section for our guests that talks about how we are cleaning each guest room, how the bedding is being washed with high temperature water to disinfect. Each guest room is kept out of service for 4 days before a new guest is checked in, that our public areas are aggressively cleaned by housemen wearing sterile gloves sprayed with disinfectant, that our public spaces are wiped down hourly. Anyway, the Peace of Mind section talks about everything we're doing, because we really do need to push. Business is going to reopen, and we need to make sure that everyone understands that we are taking this seriously, and we are going to provide as safe a space for you if you're coming into our hotel as you can. Okay, next page would be, this is another thing on our website. This, I don't know if you can see it, but it shows our front desk agent. He's behind a plexiglass shield. He has a face mask on. We also have a digital concierge called Ivy. So as soon as the guest checks in, we send them a text. The text again reminds them you need to wear masks anytime you're in a public space in the city of Santa Fe. So again, we are reinforcing what is required if you are going to come to Santa Fe, and what we will expect of you if you're going to be a guest in our hotel. So we have visual cues on the website, as well as verbiage to help guide people so that they can't say we were not aware of what's going on in Santa Fe. So the next slide shows you, so this is our front door right now at La Fonda. And you can see, first off, the front doors are open. So we're trying to keep, we've only got 2 of our entrances out of the whole city block open. This allows us to keep the doors open, and you can see it says no shoes, no shirt, no service, no mask, no service. We want front row and center, again, very clear communication. The picture on the left is one of our retail stores. Again, we're trying to keep doors open. We are trying to put signs everywhere to communicate to the guests. They got to wear masks. And also we have the occupancy requirement, because right now all the retail is limited to 25% of what the 61 person per 60 square feet per the fire code. So each retail store has had to do the calculation, and we have that on every door of every retail space to be very clear for all of the guests and anybody coming in, that if we have more people than that, we are gonna have to have people wait outside. And you can see this safety and peace of mind. That is one of the signs we have in the back of the house. Back of the house means not the public facing part of the hotel. And we have all of our signs in the back of the house in English and in Spanish. Again, we need to be very clear what our safety protocols and what we expect from our employees to keep everybody safe. So on the next page, this is, we furloughed about 240 employees early part of March, mid-March. We were one of the first. And so we have brought, we did get a PPP loan. We brought about 100 of those employees back. And when we onboard the employees, we have a COVID questionnaire. I don't think you're going to be able to see it, but it basically has them sign a form. You know, are you experiencing coughing? Are you experiencing shortness of breath? Have you been self-quarantined? If why, how long? Have you been exposed to anyone waiting on a COVID test? Have you been exposed to anyone with COVID symptoms? Have you traveled outside the region? Have you traveled anywhere in the last 2 weeks? At any rate, it's a questionnaire that before we are bringing people back from furlough on our onboarding process, we are getting them to sign something so that we, if they answer in the negative to any of these, then we'll contact the Department of Health and ask what to do. But it's really important with these employees that have been gone for 30, 60 days that we don't know where they've been. We don't know who they come in contact with. It's very important. And so I would recommend that all the local businesses do some kind of questionnaire when they bring their employees back to make sure as reasonably as you can that they are COVID free. The thing on the right is a letter that we give to every guest upon check-in, and it says, thank you for staying. You may have noticed that our staff is instructed to wear masks at all times. We have complimentary disposable masks for any guest. We also can sell reusable masks. And at any rate, it also talks about our public spaces, how often they're sanitized, that we have taken out extraneous items out of the guest rooms, like magazines, paper products, pens, all of the extraneous things we have cleared out of the guest rooms. And if a guest wants one of those, we will hand deliver it to them in a sealed bag. But we are doing everything we can so that when they check into that guest room, that it is as safe as possible. One of the more creative things I think that we've done is, if you look on the left, this is a little bitty hand sanitizer. We could not buy hand individual sanitizers. We've not been able to source them anywhere. So my creative team bought little packs, and we are using some of the furloughed people that have come back that we don't have a job for them. They are filling each one of these little hand sanitized packs with a little LaFonda logo branding on it. And we are handing these to each guest along with the letter when they check in. So even if some of these PPEs are not available, and we've really had trouble finding, you can be creative, you can make your own. And so that's one thing I'm really proud of, that we are giving each guest at check-in a hand sanitizer and a letter saying, here's what we're doing. Again, communicating what the protocols are, so it's very clear to not only our staff, but to our guests. Okay, next page. So one of the challenges is all of these things we are doing has a tremendous impact economically on every local business. All of these additional safety measures I'm just going through with you guys, and there's lots of companies that are doing others. I mean, we're all learning from each other. And I must say, from the hospitality industry, everybody has been wonderful about sharing best practices, and the competition is gone. We're all in this together, and I'm really proud of our industry. But the problem is, first off, we're paying for all of these items that we didn't budget. Most of us have absolutely no revenue coming in now. We're still trying to keep people on the payroll so we can keep jobs, but we have no revenue coming in. We're hemorrhaging money for payroll, and we're hemorrhaging money because not only are we paying for all these PPEs, but we have limits on how many people can be in the hotel, and we have to have additional staffing to clean the kitchen, to continue to clean the common areas. So our costs have skyrocketed at the very time when our revenues have cratered. And my business is no different from any other business in town. So just be aware that the business people right now are under this vice and a pressure. It's just like the city, I'm sorry, with the 100 million in the hole. Every small business is in the same spot. That we just have fewer zeros in the end of ours than the city does. But again, one of the challenges is monitoring the health of our staff. We need to create a formal written document that the staff doesn't come to work sick. We have temperature checks. We have one door that all of our staff come through every day. Before they even clock in, they get their temperature checked. And, you know, we really need to be encouraging everyone. If anybody is a fever or has any kind of symptoms, we're sending them home, no questions asked. One of the other really challenges is the safety, procuring the safety equipment. you know, we don't have buying power. Small local businesses don't have the buying power. So one of the things the city could consider is whether that it's possible to buy some of this in bulk to allow the businesses to buy through the city so that the buying power is larger. We've been working with the state tourism office to do that, and I think they're working on it, but we don't have anything yet. And one of the feedbacks we're getting is people cannot get masks, they can't get the hand sanitizers, they can't get the refills for the disposable sanitizers. So it's really an issue. But one of the other things, I'm showing you all the signage that businesses can do. The city could really be a partner with us in also putting signs all over. I mean, I've seen some signs in the parks, but around the plaza, any place that we think that there's going to be out of town guests or out of state people that are coming from places that are less restrictive than New Mexico, the city could really help all the local businesses by helping put signs, wear your mask, stay 6 feet apart. So the city could really partner with us and complement, work hand in hand with the businesses on communicating what the expectations are when you step foot in the city of Santa Fe. And I think the city could be doing a better job. We all could be doing a better job, but that's one thing I would plead and ask the city, you guys, to help. So the next slide is kind of tourism. So one of the things we're really trying to do and want local businesses to do is follow the lead of Santa Fe's tourism department. So for instance, one of the bylines is that the Santa Fe tourism is dream now, stay later. So LaFonda took a twist on that and put save now and stay later. So if local businesses could take the marketing campaign that the city of Santa Fe is doing and ladder up to that, it would help small local businesses that none of us have a marketing budget. That's the first thing that goes when economics go upside down. You don't have any money to market your business. So to the extent Santa Fe tourism can help and that we as small businesses can ladder onto your campaign, I think everybody gets more bang for the buck. So to share the brand messaging, one of the things we've pushed is advanced purchases to get people to buy gift cards, to get people to buy spa trips for later. They're good for 12 months. They're good for 24 months. It brings revenue into the businesses now that need it. And so just to try to be creative, one of the things we did, I think everybody knows, is we lit the bell tower blue every night to honor first responders. Again, if we could get the city and businesses in Santa Fe to band together and to really try to honor the first responders. Again, when tourists come to town, I think that's a wonderful thing that they would see, is that Santa Fe cares about its first responders. And that's a very visible, easy way to do it. And I think I've got a couple more slides on tourism. One of the things we all need to be doing is supporting, as you know, Indian Market is doing a virtual market. The folk art market is going to do a virtual market. So to the extent the small businesses and the city can help support these virtual initiatives, it will, I mean, what a better way to bring money to our nonprofits, to bring money to our artists without having to deal with the people here. I mean, that would be the best, is to get their money. So to the extent the city can support, I know we've talked to Randy and I know he's working on it, but I would really encourage that, because again, otherwise our nonprofits could close their door, and we all know what the economic impact that these festivals and markets have, especially for the city of Santa Fe. So another thing is, you know, should the city be the leader in promoting a calendar of the mini art markets? What's going on? I think Scott Hutton may be trying to do that, but should the city of Santa Fe own that in terms of how to promote safely mini markets? So the next slide is, so the other thing I think we can do, and everyone would agree, is one of the wonderful draws to Santa Fe is the outdoor recreation activities. That is one of the things Santa Fe has to sell. And that goes hand in hand with what Dr. Johnson is telling us, that in terms of any kind of activity, outdoor is better than indoor. Outdoor is better than cramped space. So businesses could create hiking, biking, golfing packages. I put a map here that we put together probably a year ago for La Fonda, which is a walking, hiking map from the hotel. Lots of businesses could do this. We also, to encourage exploration outdoors, outside, the city could have on, I don't know if it's on santafe.org yet, but a current list of the biking trails and parks that are currently open, and to keep it updated, because then that allows us, when tourists come to town, to push them out and to not frustrate them by sending them to places that are closed. So that would be one thing to be really important that the city could do, is be real time on what's open recreationally and park-wise on your website. The other thing, I've got to make a plug for helping us open bars and restaurants outdoors. There are a lot of restaurants and bars that have outdoor patios. There are alleyways and streets downtown that could be closed off, that restaurants could spill into the plaza, set up tables. And I really think we need to be thinking about this, because it's an easy way to ease into reopening restaurants and bars. I'm kind of surprised the governor didn't do that, because I thought that was an easy way to kind of put the toe in the water, which is any restaurant that can seat tables 6 feet apart and have them outdoors. That's a easier way to start than a restaurant that, you know, the teeny meeny with tables put together. So that's another thing I would ask the city to consider, is to be creative and maybe help some of the downtown or other businesses that could expand towards streets or to outdoors areas. That would be a wonderful way to start bringing the restaurant and restaurants to open again in a more safe manner. So my last slide is kind of a push and help for local and small businesses. Local small businesses, again, don't have marketing budgets. They are going to fold if they don't get business. So how do we as a city help them? And one thing is to partner with other businesses. One of the things we do, we partner with the Roots Bicycle Tours. So if somebody wants to take a bike tour, somebody wants to take a hiking tour, we have another local business that we refer them to. So if the local businesses can really be creative and think about partnering with other local businesses to help push the outdoor activities, then that will allow a more broad experience for our guests. And again, push the buying local when possible. We are using Santa Fe Spirits as hand sanitizer. All of the local companies that are doing PPE should be the first line of purchase for any Santa Fe business. And another thing is, you know, should the city talk about doing some downtown promotions? I'm on an informal committee with Randy Randall and some downtown businesses, and we're going to pitch something called It's Still Summer in Santa Fe, to try to push our summer to September, October, November, instead of just June to August, because we already know tourist-wise, that's a no-go. So, you know what, Santa Fe is wonderful in September, October, and November. So we are trying to pitch to extend the summer, and that's kind of our logo, It's Still Summer in Santa Fe. And instead of, for instance, having Folk Art Market up on the hill or Indian Market on the plaza, can all of the galleries or restaurants sponsor one artist, some up on Canyon Road, some on West San Francisco Street, so that you're spreading the crowd? There's not a crowd. You're spreading shoppers around, but you're still giving retail a way to make money. You're giving these artists a venue for their products. So there's lots of ways to be creative and still try, you know, be safe and not having a densely populated art fair. You could spread it out, like every shop around the plaza could sponsor one artist, and we could bring in Canyon Road, we could bring in the South Side, we could bring in the rail yard, and to have a different kind of market. So just to be really thinking creatively, because if we don't try to help these local businesses, I've got 14 tenants in La Fonda. Most have been there 30 and 40 years. And I have several of them that tell me they're not sure they're going to be able to reopen the doors and come back. And so if that's happening at La Fonda in downtown Santa Fe, imagine all the mom and pop shops throughout the city. So we really, we as a city really need to think about how to support them, because if they can't get through the next 90 days, and the PPP is only good for 60 days, and a lot of people are putting the PPP money back because it's been so difficult to use. We've really got to think hard, because Santa Fe is not going to be able to come back if we can't keep our mom and pop shops alive. So I'm hoping that my pro-business, how to bring tourists here, will marry with Dr. Johnson's presentation on how to do this safely, because Dr. Johnson wants the economy back. I know it's touched her life and her family, and I want to do it as safely and as possible, because it doesn't do anybody any good to open the businesses back and then have a spike in COVID and we're back to square one. So I really appreciate the opportunity to talk with Dr. Johnson to you guys and try to brainstorm on how to marry the two as best we can and have the city of Santa Fe be a leader in doing this.
Carol, you're muted.
And I thought I'd unmuted. Anyway, that was just a thank you to our presenters and a thank you for the information that you've given us. I think it's a lot of food for thought and helps as we, opening the economy is going to be very important for us as well, as we deal with the very challenging budget situation we have, and wanting to get businesses opened, but doing it in a safe way so that we can improve the city's revenues as well. So I did have two counselors with hands up. One hand went down, but Councilor Villarreal, you still have your hand up. So you had a question.
Yeah, just wanted to thank Dr. Johnson and Ms. Kimball for joining us and sharing information, best practices and facts. I was just wanting to follow up with Dr. Johnson about testing. Is that free for everybody at this time? And do you think that we're doing a sufficient job in the city letting people know where those sites are and how we could do that better in the city?
It is free for everybody. I'm not sure. I mean, I think we could totally do it, definitely do a better job. We have it on our website. It's on the Department of Health website, but I think, employers should, if employers are going to ask people to get tested before they come back to work, employers should also have that information, be disseminating it. And I think the biggest thing, it's increasing the volume, as I said, is important, but we also have to work with Christus and Presbyterian and the state to make sure they're getting those test results back quickly as well. And also to make sure that people understand what the test really means, that people understand that a test that's negative today is negative today. And, and if you have symptoms and your test is negative, whether, people need to be connected to primary care to really understand what the tests mean. And so I think that's another important thing to emphasize with folks, because there is a lot of drive-up testing. You can just drive up and get tested without having your provider know about it, without even having a provider. You get a result back and maybe you don't know the significance of that. So.
Does anyone know in the city or city staff if we have that on Altogether Santa Fe website, the testing sites?
Madam Chair, Councilor Villarreal, I don't know, but I can check to see if they're there. I think they are, but I'll check.
Great, that would be helpful. And
You're muted, Renee.
There we go.
Councilwoman, sorry.
We all get it one time. Ms. Kimball, I just wanted to follow up with you about the committee that you're on and all of the COVID safe practices that you all are putting together. I'm just curious, the one thing I didn't see on that list is anything that would have information for workers who don't feel comfortable and safe or don't have their employers are not providing the proper protection and equipment, that there's protections against retaliation. That to me is a big issue, considering that I feel like not all businesses follow your practices and really caring and understanding about the need to protect their workers, because if we don't have workers, we don't have business. And so my concern, I haven't seen it anywhere with the state or how they're going to be approaching how workers can file complaints without being retaliated. So do you have any information on that?
Well, I do. There is a section in the COVID safety practices that just came out for all employers. And I think there is a reference for that, what's required, but Councilor Villarreal, that's a very good question. Do you want, can I send you the manual that the state has put out?
Yes, that would be great.
Okay.
I think, Mr. Randall sent me something. I don't know if it was the full report, but I did indicate that was something that was very important to me, considering that we want to make sure the only way we have businesses that are thriving is if their workers can work safely. So I think that's extremely important. And I appreciate that you all are really taking that seriously at La Fonda. The other thing I was going to ask is, well, just let you know of your recommendations. I think there's some good points there that we could be part of in terms of promotion and whatnot, especially because tourism has a more flexibility than most of our departments in terms of ways to support obviously the tourism industry. So the one thing I did want to let you know is there are conversations that I've been part of with our staff, primarily obviously with Randy, but also with land use and our public works and obviously economic development. And it's around piloting a restaurant parklet idea, not so much closing down streets, but making sure that we could look at ways that restaurants could open utilizing sidewalks and other parking places. So that's in the works. We're trying to figure out what kind of legal implications there are for that. But it is something that I think our staff is working on very diligently. And so if you want any other information, Randy Randall has some information, so does Rich Brown. So just wanted to convey that to you and let you know that I care about that. I think it's important, not just in the downtown area, but all restaurants have an ability to kind of look at that option as we move forward now that we're getting closer to the restaurants opening. So just want to let you know about that. Thank you both for your time.
Great, and we got Councilor Rivera back. He lost connection temporarily and he had his hand up. So I'm going to go to him and then we'll go to Councilor Cassett Sanchez. And I do have to say we're going to have to wrap this up pretty quickly. So Councilor Rivera.
Yeah, thank you, Ms. Kimball, for your presentation. So as Dr. Johnson mentioned, you may have a clean test one day and then have COVID 3 days later. Are you doing testing every time an employee comes in, which I believe includes temperature testing, or is this a one-time deal just when they come back?
Well, first off, we are not doing any COVID testing. What we take their temperature every shift. So that is not just when they come back and onboarding. Every shift, from me to every employee when they enter the building gets temperature checked. The questionnaire we do, Councilor Rivera, is only when they've onboarded and come back from the furlough. Some of them have been gone 2 weeks, some of them have gone 6 weeks. But once that they've been onboarded back, then the only thing we are doing is doing the daily temperature testing at every shift.
Okay, I think that's important, and I'm glad you're doing that. My next question is for Dr. Johnson. Can you briefly talk about the use of gloves? There's some controversy about that, and if you can just touch on that, that would be great.
So it's very situational, but for me, I think gloves are overrated for most situations. I mean, I would be happy to like hear the specific, not right now, but you know, there might be a situation where it makes sense. Certainly, you know, for other things like food service, it makes sense. So where you would normally have a glove for public health, you should still have a glove for other reasons other than COVID. But you know, there's grocery cashiers wearing gloves. I was in my post office the other day. The postal people have gloves, and the gloves are filthy. I mean, you know, they're clearly dirty. And if you're wearing a glove, you're not washing your hands. You're not using hand sanitizer on your hands, and you have the sense that the glove is protecting you. When the glove is not protecting you, the glove is a surface that's probably more likely to have the virus on it than your fingers. You're not washing it as frequently. And, you know, just like the glove, just like your fingers, it really doesn't matter. The glove doesn't protect you because it doesn't affect your skin. If you touch, whatever you touch with the glove is going to transfer the virus. So I can't really whenever people ask me this question, I go back to that slide I showed about here's how the virus is transmitted. All right. And then logically, let's think about, does this help? And if it does, can we explain how it helps? Or are we just doing it because it feels like a security blanket? And I think gloves are in that security blanket category a little bit, and they make people feel protected when they're not really protected. And what's much better is just frequent hand washing and frequent hand sanitizer use.
Okay, thanks. That helps out. And then lastly, about hand sanitizer use. A while back, I heard copious amounts of hand sanitizer, so enough to cover your entire hand, and so it was dripping off. You know, the hand sanitizers that we have at City Hall just give you a small amount of hand sanitizer. Is that good enough, or should it be a copious amount?
Well, let's start by saying the best thing is soap and water, washing your hands, but for 20 minutes. Everybody knows there's a bunch of, or 20 seconds rather, not 20 minutes. You know, there's a number of YouTube videos about how to do that and get all the surfaces and do it, you know, sing a song that's 20 seconds long, all that. So if you can get access to soap and water frequently throughout the day, that's the best thing. Now, I have a bottle of hand sanitizer in my car when I go pump gas or when I go to the grocery store. Both before I go in and after I come out, I just do a pump and do it on my fingers. You know, if you're using it frequently and you're also just thinking about not touching your face, not touching surfaces, I don't think that you have to worry so much. I mean, cover all the surfaces of your hand with it. But, you know, if it's enough to cover all the surfaces of your hand, and especially your fingertips, things that touch a lot, I think that's an important thing.
Great, thank you for that. Really appreciate it. Thank you, Madam Chair.
Thank you. Councilor Cassett Sanchez.
Thank you very much. I'll be quick. First of all, thank you both for being here and for these presentations and really providing us with a lot to think about. My question is for Jenny, and it has to do with the 14-day quarantine for individuals coming out of state. And that feels like it's probably a pretty hard thing to enforce. And I'm just curious to hear, you know, what the tourism industry is doing around this. I don't believe that it is technically legally your responsibility, but I would just like to hear a little bit more about that, because I feel like that'd be really challenging for people, especially if you're coming in, you know, 14-night stay at La Fonda is already gonna, you know, be a little bit expensive, and then having a week to actually enjoy the city. So I'm just curious to hear a little bit more about what's going on there.
Well, that's a very good question, and one that there is no answer to, because when I asked the question, okay, does 14-day quarantine, what does that mean? They can't leave the hotel? They can't leave their guest room? I mean, practically. And so many people book online through sites that we don't know. And if we ask them, I guarantee if we ask, did you come in on a plane? They're going to say, no, we drove. And then what do we do? And so we are enforcing the masks. We will not let anybody in the hotel that doesn't have a mask. We will not let people in public spaces without a mask. But to be very frank, this quarantine, nobody knows how to, if I do get a lot of questions about it, and I have told people, if you are telling me you're flying in, you will be quarantined for 14 days. If you tell me, if you drive in, there is no such requirement. So I do think that is changing travel. And people, like I've talked to 3 or 4 people from Dallas, it's about an 11-hour drive versus flying. And given that they don't want to be dealing with the quarantine, they're opting to drive. But there is we can't enforce it. People are going to lie to us if we try to give them the 3rd degree. And so we know it's out there. It's part of the rules and regulations. We put it in our incoming letter, but other than that, Councilor Cassett Sanchez, there's really, to be very frank, I don't know how to enforce it.
Yeah, I assume that would be the answer, because I've also been trying to mull this over in my head, and I'm really not sure what the solution to that is. Dr. Johnson, I'm not sure if this is a question that you would readily have the answer to, but as people are flying in versus driving in, does it reduce the risk, just out of curiosity?
Is driving in safer than flying in? Is that what the question is?
Yes, essentially, yeah.
Not really, because if you're driving, I don't know what you're doing. The issue is you're in another state that probably has higher number of cases, that probably has, I'm not sure. We'll see how long this requirement lasts about the travel. I think it might be something that is at some point it's going to go away, right? It's not going to last forever. But I think that the recommendation, as I understand it, is that anyone coming in should quarantine, but there's signs in the airports, and it's more sort of an order for the airports because it's not really enforceable either way. I don't like, safety wise, flying for a long period of time is a risk factor, but also driving across the country, especially if you're staying in hotels and eating at restaurants and whatever you're doing, or going to bars at other places, that's also a risk factor. So I don't think there's a logical reason why one's safer than the other. I think one's just easier to enforce than the other, maybe, even though neither of them are very enforceable.
Okay, thank you. That's what I thought. So I appreciate you you bringing that information to us. Those were all my questions. Again, thank you both so much for being here.
Great, thank you. If there are no more questions from the committee, Councilor Garcia, I see your hand. We do need to wrap this up pretty quickly, but please ask your questions.
Not a question, but thank you, Jenny and Dr. Johnson, for your presentation. And just to follow up on Councilor Villarreal's clarification, we do not have the sites listed where COVID testing is taking place. So I think I'm in agreement with you. That's something we should add to our Altogether Santa Fe website. But I do not see it under our the health section of that website. So
we do, Councilor, according to Rich Brown, he says we do have it on the Altogether Santa Fe website. Is that what you're looking at?
Yes.
He says there's a link to the testing sites.
But we should. I think we should broadcast it loud and clear. It's one of those. You've got to follow a link to a link to a link.
Yeah.
That's something we should be promoting without having folks go down the link rabbit hole, so to speak.
Gotcha. Okay, good. Well, that's good information. Again, thank you, Dr. Johnson. Thank you, Ms. Kimball. I really appreciate you being here. This is very informative. Thank you for all you're doing. And we have to move on, but really appreciate you being here. All right, with that, we are going to move to our consent agenda. And I believe, Councilor Cassett Sanchez, you pulled off the first item, and which is, hold on, let me get back to that page. which is the ordinance regarding the use of face coverings by employees and customers when inside places of business and in public when social distancing is not possible. So you had some questions on that, I believe.
Yes, thank you. I really just wanted to, there was a lot of questions coming up about whether there was the appropriate access. Is this a draft? You know, what's going on with this piece of legislation? So I wanted to just make sure that that was clearly stated for the public, what is available and what that represents. I see Jesse popping on, so I have a feeling that you're going to answer that question.
So Jesse, I'll let you answer that question.
Thank you, Madam Chair. Councilors, the version that is posted on my website is the non-draft. It does not have the draft on it. I'm having trouble accessing the one that's listed on the weekly meeting list. The version that's in your packet that says draft is pretty much the exact same as what is being reviewed by Aaron right now and will be in the packet next week for the governing body meeting. So there aren't any, I don't believe there are actually any changes from what you're reviewing right now.
So maybe I can help now too. Just before the meeting, Aaron, so the reason it says draft across it is that Aaron had not had a chance to review it, and she normally does that and then I think signs her name or something. She did send a draft right before the meeting, and Jennifer, if you wouldn't mind telling us, you did post that to the version that doesn't say draft across it, which, as Jesse said, is the same as what was in your packet. It just doesn't say draft across it. And Jennifer, where did you post that?
Yeah, so I updated on Granicus, which will automatically update on our quality of life page. The versions that are posted through the weekly meetings list take a little bit longer to update because we have to do that manually. But I've been keeping the packet as updated as possible for you all and also for the public through the quality of life page, where all of our meetings are archived and the agenda for the next meeting is posted.
Wonderful. And I think the main point there is that there are no real substantive changes between the version that said draft across the top that more had to do with internal processes as opposed to what is being proposed, correct?
That's correct. And also I just updated my Granicus and the draft that's the version that said draft across it is no longer there, so.
And then the one question I had for the actual substance of the bill is looking at where there are where it aggravates a health condition. Right now, it looks like we have information for employees, and when an employee can't wear a mask because it aggravates a health condition. Not sure why I'm having a hard time with those words today. And I wanted to propose that we also extend that to the public, that there are absolutely situations where a mask, where somebody cannot wear a mask because of a health condition. So ensuring that we are making it clear that if there is a health reason that somebody cannot wear a mask, that is understood and they will be exempt, but that also is, again, more impetus for why the rest of us should be wearing a mask, because we really would like to reach that 80% threshold that research is showing is beneficial for helping to stem the spread of disease. So at this point, would we work offline to create that? And then when it comes to public hearing, that's when that final.
Yeah, I think we should look at doing that, and maybe we can get an amendment before it goes to finance to that.
Madam Chair, if I may.
Yes.
Councilor, on number 6 is what you're looking at. So the first sentence is when wearing a face covering causes or aggravates a health condition, which covers everyone in the public. The second sentence, and I apologize if you hear my kids yelling behind me. The second sentence is more specific to employees, and so it covers everything in that number 6.
Okay, I don't feel that that's very clear, but maybe I missed a sentence. Oh, I'm sorry, because I see the B, face coverings are not required in the following circumstances.
second sentence just happens to fall on another
Yeah.
line, which makes it
So
seem
I
like it's
think
just
what
one sentence.
happens is it's a, sorry, it says B and then C when wearing a face covering, and that should be a 6 as opposed to a C. And so it's just the
Oh,
structure.
sorry, that may have been a
That's
change
why
that I
I
made
was
between the
confused
draft
there.
and this.
That
Yeah,
clears it up,
that should be
so-
number 6.
Great. Okay, perfect. Well, thank you. I'm glad that's
Yeah,
already taken.
we can get that fixed. Other questions?
Madam Chair, just the formatting is funky, so maybe that will help, not with just the C, but the spacing and the indentations of each section.
We'll take a look at that. Counselor Garcia.
Thank you, Madam Chair. So I took some time to look at other cities that are instituting a mask/face covering policy. And it looks like a lot of them are instituting at least no higher than age 8, and we've got age 10. So just wanted to get clarification on why age 10.
Yeah, so I think it's an interesting question. So I believe the governor's proclamation, Jesse, correct me if I'm wrong, says 5. Is that right?
I was looking at it earlier today and I didn't actually see an age,
Okay.
but I think it could be 5. I also looked at some other cities and states while doing this, and they range from 2 years old to 12 years old. So having a 2-year-old and a 3-year-old, I know that neither of them it wouldn't do any good. They would pull it off. They'd constantly be touching it. That's not worthwhile. So
Well, that
based
kind of
on
gets
the other
to my
based on the other research we did, we decided on 10 years old.
right, and that kind of gets into my second question, because there are other cities that have language where it doesn't mandate at a certain age because the youngsters will be taking it off, and so I think age 10, I think once you get to even, I know my 8-year-old would be responsible. She has a mask. She doesn't take her mask off. So I think that's something we should discuss. What is the appropriate age if we are looking at protecting folks? And I'm thinking more so long term, if we are gonna be having folks wear masks, what does it look like in the future, especially youngsters, and if there are in schools? And I think those are bigger questions we need to ask. And what's the requirements around that? But I definitely think if we're going to require folks, I don't think 10 is the appropriate age cutoff. I think we should be more responsible and look at maybe a lower age, 7, 8. But I think that's something we can discuss offline. I just didn't know why we settled on 10.
Yeah, I think, Counselor, it was, some cities have said 12. 12 seemed too old. And, to the points that have been made at age 2 and age 5 seem too young. And so it seemed just based on experience that 10-year-olds probably are old enough to understand. And, maybe some 7 and 8-year-olds are too, but 10-year-olds certainly should be old enough to understand that, they need to wear it and why. And so it is kind of an arbitrary number, but we can certainly, offer an amendment, offering a different age or taking the age out altogether, whatever the folks think. Councilor Cassett Sanchez, you wanted to weigh in on this?
Yeah, I know in previous work that I've done, working with kids, we often will put in this phrase of at the appropriate stage of development when XYZ. And so that could potentially even be almost a catch-all. So kind of, when a child can appropriately wear a mask without taking it off, so that might be some language that we want to explore in other areas and see how that could potentially assist that.
Councilor Garcia, I think you had the floor prior.
Okay. So the next question was in regards to enforcement. And so the current, penalty for not wearing a mask is $50. Another thing I've seen, across cities is a $0 fine, all the way ranging up to $1,000 fine. Is there a way to have a staggered approach for this, in the sense where we have a lower fine at first, and then if an individual has reoccurring instances, the fine goes higher? Because this is something new, and we are now, which is in essence requiring folks to either purchase a mask or utilize materials that they have around their house that they would feel comfortable for a mask. So I guess, yes, go ahead.
Yeah, so excellent point. I actually have asked Jesse to draw an amendment to address that very concern. I would say that I have said when I introduced this bill that I think that we want to stress, we don't want to be in the business of offering citations. I think that's something that we want to do as last resort. And this is why I think that the next thing that we're taking up is the mayor's resolution, the Santa Fe Promise, where we really want to do an educational campaign, and we want to get people to do this voluntarily. And so I have asked that Jesse do an amendment so that your first quote unquote violation would be a warning. And then, certainly open to discussing whether, from there it goes to a second violation is, a $50 fine, if that's the right amount. I don't think I would want too many steps in this, just for simplicity, I think. But again, I do want to emphasize that we want people to comply because they understand that this is the right thing to do. And we want to be in a place where we're educating and not being punitive, especially as folks get used to this, this new standard. And people are coming from, other parts of the country and the world where there are different expectations, different standards. So I think that would be a good change. And I have asked Jesse to work on that. And Jesse is raising his hand to offer his thoughts on that.
Thank you, Councilor. So I did do a little research on what we have currently in code, and an example that we could use is from the Santa Fe Smoke-Free Ordinance, and they have progressive penalties. And in discussions with Councilor Romero Worth, we had talked about having it a warning for the first violation, and then just to have people understand that we are serious about this, and then for a second violation, then imposing a fine. So I messed around with the wording a little bit, and in that section 20-7.5 under penalties, the language that I thought we could put in would be, any persons found guilty of a violation of this section shall be guilty of an infraction punishable by A, be a written warning for a first violation, B, a fine not exceeding $50 for a second violation, and C, a fine not exceeding $100 for each subsequent violation of this section. So that's just a quick idea of what we could put there.
Great. Thank you. Thank you for looking into that, Councilor and Jesse. Do we have currently any anti-mask ordinances on our books? I know that I read, I think a city had an anti-mask ordinance, and it more so pertained to, I think it was focused around maybe Halloween masks, Halloween time, et cetera, but it was one of those catch-alls where because this now is opposite of what a current ordinance is, it put them in a predicament. So do we currently have any anti-mask ordinances?
Madam Chair, Councilor, I just did a quick search for mask and face covering, and nothing came up in our city code. So unless it's called something else that I'd have to search for, we do not.
Okay, thank you for that quick. And I think just it'd be prudent for us to do a good search. I'd hate for us to, if we got through the whole process on this and be something, it'd be counterproductive to what this ordinance is trying to make happen. Are we going to set a sunset on this? How long do we plan to have this ordinance in effect?
Madam Chair, Councillor, the legislation, the last section, 20-7.6, the effective date says that this ordinance will go into effect immediately upon adoption and will expire when the CDC withdraws their face covering recommendation. So
Will
I don't
they,
know when that would be.
so I mean, and I haven't lived through many pandemics in my life, thankfully. And so I don't know, does the CDC say it's okay to not wear masks anymore? Do they just leave it as is? I mean, what has historically been their case? I mean, because if we're going to write this into the legislation, we want to ensure that there is a benchmark that folks will be able to meet soundly.
Madam Chair, Councillor, I don't know that we've had a situation where the CDC has recommended face coverings before, so I don't know that there's any precedence to that. However, if there is a consensus among the community and the governing body that, you know, this has gone on long enough and that we really don't need it anymore, the CDC hasn't withdrawn their recommendation, but we don't need it anymore, we can just repeal this ordinance. So it's not set in stone that that's when it comes to an end. There are other avenues.
I'm not a medical expert, so I don't feel I'd have the expertise to put forth a request like that. So I think if we can look at another measure, another benchmark that we could potentially add in, just not solely relying on the CDC, I think that would be great, just because we don't know when this is going to end. And another thing, the CDC acts as a country level, not as a state level or at a city level. So what might be impacting another part of the country might not be impacting us the same way, where we can ease restrictions. So that's where I would like to have a more local kind of benchmark set instead of a big national.
So, Counselor, we did consider that. We did look at language that said that the face covering requirement would sunset, if you will, when the mayor and the governor withdrew their emergency proclamations. The problem with that is that there was some thinking that we may still be in a quote unquote COVID world, even if we're not in an emergency proclamation period, so that we might want the mask or the face, I've got to get used to saying face covering requirement to extend beyond when the emergency proclamations or declarations were withdrawn. And so that would have been the more local way of doing that. We could certainly look at some sort of sunset date where we, reconsider, but we can continue to look at language on that. It seemed like the CDC was a better authority for, doing this based on the medical reason for having it, and that was a standard that would be, objective and one that we could really lean on. But, I'm happy to continue to look at other states. We just saw San Jose, California. Their city council will be considering something similar here. We can look at what they did in terms of sunsetting. Denver has this kind of thing. In our own state, we've got Las Vegas. So we can continue to look at provisions on how to get this requirement to sunset when it's appropriate. And I'm open to doing that. But the conversations that we had, the CDC seemed like the most objective and reasonable.
No, understandable. But I think, like I said, having a more local approach as well added. And I see the arguments for not using the benchmark of whether it's the mayor's emergency proclamation or the governor's, but I also see it as an opportunity to revisit the ordinance, and not to say that it would sunset with the pulling of that, but it would come up for reconsideration at that point. And that way the body can make that determination. So maybe that's a way to approach it. Instead of having it clearly sunset, it would be reconsidered at that time.
Yep. I'm definitely willing to look at that.
Okay, so a challenge I see we potentially putting our city staff and in particular potentially our bus drivers, because we would potentially deny service to patrons. And then in essence, we turn those bus drivers into having to enforce the ordinance. And in some instances, I'm assuming you're gonna have some folks that will be grumpy with not being allowed on the bus because they might not be able to make it to work that day or make it to their destination. Have we considered how we are going to deal with that? How we're going to support our city staff when they're put in those instances?
Sorry, trouble with my mute and unmute button again. Well, first of all, it is a state mandate by the governor. She says you have to wear them when you are in public. She does not define what that means, so it's very broad. And this ordinance is very specific as to where we as a city think you should wear them. And if you're not wearing them, we give police the ability to issue citations. So I don't think it'll be the bus driver, and it won't be our retailers and our businesses, as we heard Jenny Kimball just a while ago talk about being in that position. It would be, the police department, and like any other infraction, they would be called upon if needed to help.
Okay. I just do see some challenging instances in our future with the enforcement should this ordinance pass, and I'd want to ensure that our team members with the city of Santa Fe are protected and well trained to deal with those instances.
And again, I think this is where the education piece, the Santa Fe Promise, which is the resolution we need to consider next, it will become very important. I think the mayor has been talking about buttons that say, I promise, or I promised, something like that. And really getting people to understand why it's in their best interest. And it's one of, the few tools we have out there to keep the public safe as we reopen. And we've heard from Jenny Kimball tonight about why that's important. And we know from our own budget deficit why that's important. And we're trying to balance the public safety with our economic need to reopen and get businesses back on their feet.
Right. And as I'm sure other counselors have gotten an abundance of emails, this question is more so around, are we going to be violating anybody's constitutional rights and their freedom of expression?
I see this like a seatbelt law, and we have those.
Okay. So I just want to make it clear that I'm definitely am not against wearing face coverings or masks. Actually, me and my family, we each have a couple of them. That's something I think that we are doing to ensure our safety, and we're promoting this, not only our safety, but the safety of others. I think that's something that is sometimes lost. We're not protecting ourselves, we're protecting others in the community. And so should we move forward with this, I want to ensure that we are doing so in a manner that is in the best interests of our fellow community members, and we're not putting those that might not be in the situation to go out and purchase a mask. We provide the resources for the community to how to properly protect themselves, whether it be promoting how to make a mask out of your household materials using something like bandanas, whatever it may be, because I think we don't want to set our community members up for failure and having interactions with police, which might make them uncomfortable. So I think that's something, should this pass, we need to start planning since now how we are going to start educating the community on how they have to be in compliance. With that, I think that's all the questions I have at the moment, Madam Chair. So I'll go ahead and defer my time. Thank you.
Thank you, Counselor. And I would point everybody to the governor. She actually in her press conference, probably 2 press conferences ago, actually did a demonstration on how to take household items and make a mask. And that's why I also have been trying to say face coverings and not mask, because I think, you know, a simple bandana works just as well as anything fancy. So thank you for those comments. Are there any other comments from the committee on this bill? What's the pleasure of the committee?
That was Counselor Cassett Sanchez saying she moved to approve, and I'll second.
Yes.
All right, we need a roll call, I believe.
Counselor Cassett Sanchez,
Yes.
Counselor Villarreal,
Yes.
Counselor Rivera,
Yes.
Counselor Garcia,
Yes.
and Counselor Romero Worth.
Yes,
Motion pass.
we will work on those amendments. As I said, I have Jesse working on some, and we can look at some others and make sure that we are doing this in the best way possible. There are lots of examples out there with cities that have moved in this direction. All right, with that, we'll take up now the next item on our agenda, which is the mayor's resolution on Santa Fe Promise. And I believe, Councilor Villarreal, you said you had maybe some changes to that.
Minor amendments that I'm going to do in 1 minute because I'm leaving soon. So just Jesse, an FYI, check if you could just check on page 1 the spelling of Ogapoge. I've seen it spelled in different ways, so maybe just check that. And then on the last page, it's number 9 on page 3, number 9. It says, "I promise to practice patience, compassion, empathy, connection, and love." I'd like to add respect. Patience, compassion, empathy, respect, connection, and love. And be it further resolved that we will stop the spread of COVID and prevent a second wave. Instead of attack, I'd like to say infection or something more comparable. So I'm proposing the amendments for tonight, those minor changes. And if there's any questions.
So do you want to move the passage of the resolution with those amendments?
Yes, please.
And I don't know, Mayor, I see you here. Do you want to comment on any of that, or just watch the proceedings?
I know you had such a good couple of presentations, and the hour's growing late. I don't need to weigh in, but I do appreciate the support on this. I think it is part of everything we heard from both of your presenters about both staying safe and having Santa Fe reopen. We're really working both sides of the equation here. We are promoting a Santa Fe Safe campaign and a Santa Fe Fun campaign. And the whole point of this resolution is to say that because of the support, as you said earlier, Madam Chair, of the way in which people in our community have rallied voluntarily to meet the challenge of staying safe, now we're able to pivot to Santa Fe Fun. So I think they go hand in hand, and I certainly appreciate folks backing this, promoting it, and helping grow both sides of the coin. I think that's where we are right now. So thank you very much. Appreciate it.
Thank you, Mayor. All right, so I'm sorry, I forgot where we are. Councilor Villarreal, you're moving the resolution forward with those amendments?
Yes.
All right, is there a second?
Second.
Councilor Cassett Sanchez is a second. Is there more discussion? Councilor Garcia, did you have an? Okay, all right, if we can get a roll call on the resolution, that would be great.
Counselor Villarreal,
Yes.
Counselor Cassett Sanchez,
Yes.
Counselor Garcia,
Yes.
Counselor Rivera,
Yes.
and Counselor Romero Worth.
Yes.
Motion passes.
Thank you. And with that, we will move on to our last presentation. which is about city funding for nonprofits. And I think our presenters on this for sticking with us. Sorry, it's taken us a little longer than I thought to get to this point. And I don't, who's the lead? Kira, do you want to take this, or Rich, is that you? How do you want to handle this?
Madam Chair, this is Rich, councilors. Kira was the lead on this, but maybe Julie has a presentation that she's going to do for community services. I think that each of the departments have a small overview because we're very unique in the funding models. I see Kira's just arrived, so maybe Kira would like to start out, and then we can take turns, Kira, me, Alexandra Ladd, and then Pauline.
Great.
So Kira just let me know she's having to reconnect, so it'll be just a moment.
I'll watch for her here.
And so we also had a PowerPoint presentation. So Jennifer, I don't know if you're going to be sharing that, or if you want me to share my screen.
Yeah, it's up to you. I have it as default, but I think it probably works better if you want to control it yourself, so you can, keep on pace. But let me know if you have trouble, and I can always pull it up.
Okay.
Not sure where Kira is. Nope.
Hello, I'm sorry.
There
Can
you
all
are.
hear me?
Ah, there you are. Hi.
Apologies, I had to switch to my phone because my computer connection's not working. Sorry for the delay.
No worries.
So thanks. And Julie, if you wouldn't mind sharing the screen as I talk, because I can't from my computer. And we probably have way too much information in this given the hour, but we really just wanted to let you know that we have a very strong funding arm of community services. As many of you know, you can go to the next slide. We have three main committees that fund: the Human Services Committee, the Children Youth Commission, and those are that's the bulk of our funding. And then we also have the Veterans Commission, which funds as well and issues service contracts and public PSAs to nonprofits in the community. I'll start with the Human Services Committee, and then I'll turn it over to Julie to give a really brief sketch of how we measure impact with these funds. The Human Services Committee was created by an ordinance in 2016. It is a 7-member committee of citizens with expertise in the field. Our chair is actually a former Department of Health department head. And we have typically been able to grant about $900,000 a year to nonprofits for safety net services. And that's about 2% of the GRT per the ordinance. The committee does a yearly strategic plan, and it's based on the vision that we want to make sure everybody has the resources they need to thrive. They revise that vision and mission yearly, and they use a results-based accountability model, which is how much did we do, how well did we do it, is anyone better off? We contract with a wonderful consulting group called Aspen to help us with data support for our grantees, as well as evaluation, and every grantee reports quarterly on numbers served, tailored performance measures, which Julie will go into a little bit, and then the population level health goals. Obviously, we don't expect one individual committee or agency, excuse me, to reduce suicide in Santa Fe County, but if we're all measuring together and working together, we can meet some of those overreaching goals. The contracts are now deliverables based. They're based on how many people were served and how performance measures were met. And we also have a 2-year funding strategy. We've, as many of you know, adopted a strategy of navigation, which is really supporting the people in the agencies that are case managing, getting people to resources via Connect, and that's the city-county partnership. Next slide, Julie, you can do a quick sketch of some of the impact that we're seeking and what we've seen in terms of measuring impact.
So I have a separate slide kind of towards the end on the outcomes that we've seen using this kind of funding mechanism. So I don't know if you want to just briefly go through some of this, Kira, and then we'll get into the impact. Kind of
Well, I think given the hour, maybe I know Jennifer can provide this slide deck to the Quality of Life Committee, and maybe that's the best way to go. So we can just do a sort of, real quick sketch. We're looking at in human services, adult health. We measure that with public health, population level health indicators that match to larger data sets. Behavioral health is another important realm, community safety, including homelessness rates, fall-related deaths among the seniors. And then this category of an equitable society, we're really looking to serve with this safety net funding and making sure that we're hitting those sectors of our community that have historically been underserved. So we're looking at percents of unemployment, education. And then just on the last slide here under human services, we'll see the funded agencies. These are the agencies now. Julie, if you could switch the slide to currently funded agencies, they are funded last year or this current fiscal year and the upcoming fiscal year. And then moving on to the Children and Youth Commission, which was also created by an ordinance in 2001, which was revised in 2018. It's a large commission, mainly because it's merged with the Regional Juvenile Justice Board last year, so that we could be more strategic about how we were using the CYFD funds that flow through the Regional Juvenile Justice Board to be in alignment with the CYC funding. This is a larger pot. It's 4%, 3 to 4% of GRT. It's been historically about 1.25 million annually. A lot of our nonprofits rely on this funding, especially the smaller ones, to help them with operating expenses. It's again, same format. It's a yearly strategic plan using RBA. And again, in this upcoming funding cycle, which we've just received and the commission has made its funding decisions, we also are emphasizing navigation via the Connect partnership that we have with the county. In the funding categories for CYC, we look at early child care, supplemental education. This was a big focus, especially in our partnership with the Santa Fe Community Foundation over Opportunity Santa Fe. We've also got another category of youth wellness, and this is everything from behavioral health indicators to some education in terms of prenatal care for pregnant teens, et cetera. And again, because we're merging with the Regional Juvenile Justice Board, it's alternatives to detention programs, and we're trying to impact keeping youth out of the system. And then all of these are tied into outcomes that we're really seeking to track. And these are our funded agencies. I'm sorry, I'm a little off kilter with Julie. Thank you, Julie. And there are quite a few that are served through this larger pot of funding. And these contracts will end now June 30th, and our new agencies will be beginning hopefully here in 2021. And that was a 3-year funding that we're looking at. So I'll let Julie talk about what she's seen in terms of impact. She's been a champion and a leader in all of this work. And so she's really got her finger on the pulse of some of the details. And maybe you can just give us, Julie, some of the highlights of some of the positive outcomes that we've seen through this funding, tracking data.
Yeah, absolutely. So kind of as the slide shows, some of this data, this actually comes from fiscal year 19 and the final reports that we received. And this is a very, very short list of folks that have provided us with data. Our data consultant kind of put the information together. And really, we've seen a lot of, like Kira said, positive outcomes. Just in looking at some of this suicide, which is a priority area through the Children Youth Commission. One of the agencies that we currently contract with is the Sky Center, who served about 400 students 87% who were admitted to the ER for self-injury actually did not return back to the ER. There was a 64.5% decrease in suicidal ideation and depression in the youth that they were serving. And so they measure a lot of their outcomes via various assessments that are all evidence-based. And so there's really been a lot of positive impact in that particular population that they're serving, especially given that our suicide rates for our young people is really high within the city. So I wanted to highlight that organization. Also really wanted to highlight the Santa Fe Public Schools Teen Parenting Program, which is another CYC funded agency. They currently served about 60 students over their contract year in fiscal year 19. And 100% of their pregnant teens actually received prenatal care. And so none of their babies had low birth weights, which is really positive. And then of those, 95% of the seniors actually graduated from high school. And what isn't highlighted is a significant portion of that 95% actually went on to a higher education. And so they provide services not only to the mothers who are graduating high school, but they also continue working with the mothers in the first 2 years of higher education. So they've seen a lot of really positive outcomes with that population. Another agency to highlight is Coming Home Connection, Human Services funded agency. They were brand new to city contracts. They actually had not ever been funded by the city in the past. And so their group is primarily seniors who are very vulnerable, who've been referred through Adult Protective Services. And so last year they served 60 clients with home care, provided 250 units of free equipment, and then 80% of their clients actually reduced the number of falls in the past 6 months by the end of fiscal year 19. And we see that falls among seniors actually is an indicator for an early death or early demise in that population. And so that's really significant for the folks that they're serving. Again, a couple additional agencies, you can go through and read this within your packet. You know, some of these agencies have been funded for a really long time, and it's not until we adopted the results-based accountability measurements that we were actually able to see positive outcomes coming from these agencies. And so we've been doing RBA for roughly about 2 or 3 years now. And so we actually have quite a bit of data, and I would love the opportunity to eventually be able to have more time to kind of talk about the outcomes that we're seeing, as well as our strategy of navigation and getting these agencies into the Connect network. So again, really rushed, but more additional impacts with other agencies that we've been funding. And so I'm not sure if Kira is still on, but really quickly, one of the other funding sources that we do have in the Youth and Family Services Division is veterans funding. And this was actually probably our newest board, which was created in 2013. It's actually created through a state MOU through the National Cemetery Fund. And so their goal really is to be tasked with veteran resource development, coordinating recognition events, and then recommending funding to benefit Santa Fe area veterans. And so their priority areas are similar to some of our other boards and committees. Their focus really is around education, housing and homelessness, community support, and recognition. They also have, they're unique from some of our other committees because they have an actual 501c3 fundraising arm. And so because of that fundraising arm, they were actually able to raise about $40,000 this current fiscal year, which helps support these priority area programs. Their funding is not tied to the GRT. Once it's expended and we meet the parameters of that MOU, they will no longer have any funding to give out to the community. So helping them establish a 501c3 was really important in driving some of their work. And again, like our other boards and committees, their strategy is really focused on navigation via the Connect network and being a part of that city-county partnership. And then just really briefly, I wanted to touch on some of the COVID funding that we had received late March, and some of the partner agencies that we've been able to contract with in order to get some of that emergency flexible funding out into the community. And so these are just some of those partner agencies, and the total allocation of those funds was approximately $275,000.
And then I wanted to just briefly show you some of the data that we're getting out of our Unite Us platform that we use and the navigators use in Connect. Also just a shout out to the Veterans Navigator, whom you know, Elizabeth Martin, who's actually housed, I believe, 7 veterans since she started in the fall, which is a feat. But this kind of tracks what we're seeing, especially since we started the self-referral platform where people are able to make a request on our website. Our coordination center has made 205 different referrals from those people that have referred in. Service episodes aren't people, but they're referrals. This represents since January 519 people served, and the biggest issue is housing and shelter, and we can drill down into all of that at another time. But really, when we, if you can give the last slide, Julie, when we think about what our strategies are here, we don't have a huge pot of money. We didn't have a huge pot of money before with 1.2 and 900,000 and the veterans money when you think about the scope of need. Certainly now with our budget situation, we're going to see a shrinkage in these funds, which is very unfortunate. But always we've really wanted to leverage these funds to bring in state funding, federal funding, foundation funding, because we're looking to create a network of nonprofits that take care of Santa Feans in a certain way, with an equity focus, where we're really looking at our social determinants of health, the housing again, the food, the transportation, and how all of these agencies, the city's direct services included, can work together to create some outcomes we want to see, such as reductions in homelessness, reductions in suicide. And we, again, are looking to really seek sustainable reimbursement now more than ever for the care coordination that Connect is doing. If you think of the MCOs and the amount of funding they get for care coordination, we're doing care coordination here in Santa Fe and Santa Fe County. And we've had initial conversations with HSD and Department of Health in partnership with the county to seek a sustained funding source for some of this work so that the nonprofits that do such good work in the community can have a way to pay their people and continue their work. This is safety net funding for community health and quality of life. And there's a triple aim here. And it's really to increase access of our community, especially the most vulnerable, to services they need, to improve population level health. There's no reason that, just as we're sort of, knock wood, doing really well in our COVID response in Santa Fe County, we can do really well in population level health outcomes with a population of 100,000 people if we get our arms around it and get our arms around the data. And ultimately, this really saves cost to the system overall because, we're already seeing with some of our homeless response during COVID times, reductions in the calls for man down, reductions certainly in the burdens to the emergency rooms. And so we need to really keep in mind that these are good investments, and we hope that we can continue them because we really believe that it helps us leverage more funding. So thank you, and we'll move on to our other wonderful community development folks on the panel who would have presentations on how they fund.
Rich, I think that's you next, yes? And I think you're muted.
Okay, I'm unmuted. I'm going to share my screen and I'm going to start the presentation. Okay, thank you very much. I'm going to try to make this as short as possible because I know we're short on time, and I have just a couple slides. I'm going to run through them, and I'm going to send a copy PDF to everyone so that you have them. This is about economic development and the topic we had about gaining an understanding of the funding of the community from our department standpoint. We have a kind of a different funding model than the community services, but I wanted to show what we show from a contracts and sponsorship standpoint, where we allocate money to create wealth and better the community. Tier 1, I consider, is the contract side of it. We have a number of business relationships that I show here: the Business Incubator, Make Santa Fe, the Regional Development Corporation, Film Office, SCORE, Creative Startups, and we do LEDA, Business Incentive Growth. These can be connected into a couple categories: entrepreneurship, workforce development, industry cluster development, and also business expansion. So these all fit into those categories. On the sponsorship side, direct and business ecosystem, we do sponsorships for ecosystem for entrepreneurs, little small organizations, workforce, looking at the pre-boomerang audience, industry cluster convenings, trying to diversify our economy, and then also small business growth. As you know, we're dealing with an economic depression right now, and so it's more than ever we're digging into that. On the ecosystem side, we work with a lot of partners on workforce development, work with the chambers on different events and activities, and we work through our entrepreneurship network just to make sure that innovation is growing still, whether the economy is growing or it's flattening out. How they govern, that's a question that was asked. They're created, the Tier 1 contracts are created through RFP that go through a governing body, city council approval with a recommended finalists. The LEDA grants are based upon targeted businesses that we see growth, and then we work with the state and the city together to create a partner participation agreement, and then we figure out how much funding we would give for these expansions based upon performance like jobs, salaries, over year growth. Tier 2 sponsorships are based upon our missions, the mission of what we're doing based upon our economic plans, and most of them are under $20,000. Here's some funding amount information that you can see the different numbers. They're per year. Usually the Tier 1s are 4-year contracts, and some are coming up in the next fiscal year. So we're trying to figure out whether or not, with our deficit, we can afford to renew or grow or reduce or delete as we move into this next fiscal year, based upon some of the returns that these contracts bring. On the sponsorship side, these are the funding amounts to some of the things that we do based upon what I had in my last slide. As you can see, they're very small amounts, but they're to activate engagement in the community from an entrepreneurship, community building, networking, and awareness. Decision process on the contract side, I spoke about the different drivers, economic drivers, workforce development, et cetera. On the sponsorship side, these are the different parts of the mission we're looking for: wealth creation, loss of human capital. We want to keep the brains here, industry cluster development to diversify our economy, building our ecosystem so that everyone's not dependent upon the city for business growth. There's an ecosystem that can help. And data impact, there's a much greater data, and I was very impressed with community services and the impact and the data they had to show, but I realized that we had a short amount of time, so I just wanted to give you a snapshot of some of the different data points we have. Each of them has different performance measures that we go through, but we look at growth of entrepreneurship. We just finished a food industry sector entrepreneurship program. We had 10 food entrepreneurs in that. We're working with the Regional Development Corporation. We give parts of a mini grants to local entrepreneurs, and then Make has stopped its programming as the pandemic raged on. But before that, they were working on programs to help job training. And one of the new things they were doing was working with the School of the Deaf to help them with different types of maker type programs that they could see job growth in the future for them as graduates. Also, we have 2 films going on right at the Garson Studios. We have another one that's in play that we're very excited about. And then our SCORE partnership has done lots of COVID-19 related business advice seminars, and we have a couple coming up this week, and then there are more coming before the end of this fiscal year. And then we're in the process of providing a LEDA growth grant, not from us, but the state gives us the money for one of our local businesses with their special LIDA 0% loan that's tied to COVID-19 related business growth. On the qualitative side, increased business social networking, increased interest in local businesses to employ options, relationship building. We want to create a more positive impression of the city as a business and a community provider and resource. We're trying to gather data on make future policy decisions. And we're looking at affinity relationships within the industries. There are a lot of industries that are just siloed. We want to make sure that they start talking together so that we have one clear voice as a city of Santa Fe. Funding strategies, I talked about the contracts. We get money from the enterprise fund. We try to get EDA grants for targeted categories, and we want to create a grant writing program. I think it's important in these times that we start finding grants using other people's money, so to speak. So that's something we're looking at moving forward. Tier 2, same thing, foundation and federal grants. And then long-term, we want to allow more sustainability with some of our contracts. Some of them are years and years old. We've had contracts with some of those vendors in the previous slides for 15, 20 years. And we're looking at ways to make them more sustainable so that they're not completely reliant upon the city as the major funder. And then mixing the city with, mix the city funds with grants and increasing awareness of the resources that are out there. One of the questions was a vision of city as a nonprofit funder. We just do contracts and sponsorships. And then we work as a fiscal agent with the state on LIDA grants. On the nonprofit ecosystem side, we work with foundations. We have a couple of local economic development associations we work with. And then the federal government, that's Economic Development Administration. They offer grants. We need a grant writer for most of those things, but we're learning to partner with many more of our ecosystem. And we're working on one right now with the county that we hope to drive from a workforce and job training standpoint. There was a question asked about the emergency community funding. What's an update there? And so this is kind of where we are so far. We've served prepared meals with YouthWorks who are isolated in quarantine. This is kind of what we've spent so far on the food side. On the Connect, we created some rat card flyers that we gave out at the food distribution points just to provide awareness. And then we're moving into this reopening, as the mayor said, the Safe Santa Fe Fund. So we're looking at I Promise buttons, and we're looking at distributing face coverings, protective coverings and masks at the distribution points and also at small businesses, and creating information flyers. Lastly, we're also about to launch the Wi-Fi hotspots. And so we're creating some flyers so that we can pass them around again at the food pickup stations where those folks necessarily may not have a Wi-Fi as an option. So we had $75,000 to spend. We're probably, I don't know exactly where the food money has dipped in yet to it, but if you look at the right-hand side, we're probably going to be about 20,000 more before the fiscal year ends. And that's it. Thank you very much for the time.
Thank you for the presentation. From there, where do we go? Pauline or Alexandra, which of you would like to?
I'm happy to go.
Okay.
Okay with that, Pauline?
And then we'll wrap it up with the arts.
Okay. Okay. So I'm representing the Office of Affordable Housing. I think all of you probably know that. I wanted to just spend one moment on kind of our approach to supporting affordable housing in the community. Rich uses this phrase a lot, the three-legged stool, and I really think it applies here, because if we don't do all of these things, then we're gonna fall over. These are all mutually supporting. Our policy and regulation, I administer the Santa Fe Homes program, which is in our city code and requires the inclusion of affordably priced units in new development. The policy that I work with, we have two main plans. It's a little, they overlap a little bit. They're done for different reasons.
And it's sort of annoying that I have two of them, but I do. So I do a 5-year consolidated plan for HUD every year. It's updated through my annual action plan. And then I have a 5-year strategic housing plan that guides the disbursement of our affordable housing trust funds and provides us the exemption from the anti-donation clause. The second leg of the stool is capacity building of our community partners. And so we really have over the years developed kind of a collaborative way to develop programming in the city. And that's some of my favorite work. It's really great to do that. We've got in Santa Fe some of the best nonprofits in this whole state. Our delivery system via nonprofits is extremely robust. And then we have the third leg of the stool, which is the funding. I have two main sources of funding: community development block grant funding from the federal government that we receive directly, and affordable housing trust fund from our local development revenues. They are both guided by codes, the my federal regulation C, what does that stand for? Anyway, federal regulation and our local city code. And then I also provide funding through our general fund. Our funding process, I think that was one of the questions. We do a double RFP, usually in January. The Affordable Housing Trust Fund is triggered when there's $400,000 or more in our fund. We base our allocations on the previous year's balance, so we're never in the red when it comes to our trust funds. The RFPs go out together, and as I'll explain later, the two programs are complementary. They fund a lot of the same things, but they also work in different ways, and they're able to kind of fill the gaps in for each other. The Community Development Commission, chaired by Councilor Villarreal, considers all of the funding applications and makes the funding recommendations to the governing body. Applicants make their presentations to the Community Development Commission in February, early March. My staff has to prepare an annual action plan, which is the annual update of the consolidated plan for public review and comment that describes the proposed use of CDBG funds. We also usually include mention of the Affordable Housing Trust funds, but HUD doesn't really care about the local funds. It's submitted to HUD, HUD approves it, the professional services agreements are set up, and hopefully by July 1, we're off to the races and providing services. All of the subrecipients or grantees provide detailed quarterly reports. We report those to HUD. The CDBG accomplishments and the Affordable Housing Trust Fund accomplishments are reported to the New Mexico Mortgage Finance Authority. I want to spend a little bit of time on this because I think this is really important. So I've been connected professionally to the city of Santa Fe for 20 years, actually 21 years, hard to imagine. And I think the city embraced this philosophy early on, and it really, really has leveraged public funds amazingly. By actively building the capacity of the community-based partners, the city was able to ensure that services are relevant because they can react to the people walking through the door. They're nimble, they're not bureaucratic because they're provided by a nonprofit, and they're accessible to the people that we're trying to help. A lot of people don't trust the government. A lot of people get frustrated with our clunky bureaucracy. And finally, and this is a very important point, because I'm outsourcing this work, I, as an individual staff person, do not have to be an expert on property management. I don't have to be an expert on income certification. I don't have to be an expert on how to write a development pro forma. I just have to know enough about it to know if people are doing it right, but I do not have to have all that specialty in-house. And that's, I think, means that I can get by with a staff of 3. The federal funding calls the nonprofits a subrecipient, and our local funding, we have two ways we get it into the community. One is through fee-for-services agreements. And the other is through the Affordable Housing Trust Fund, which is, I'll talk a little bit more about what's appropriate, what's allowable for trust funds. And I think the other important point to make is because this model is outsourcing, the the subrecipients and the grantees, they can leverage these funds and raise extra funds from other sources. So they're able to say to other funders, hey, we just got a $200,000 CDBG grant to fund down payment assistance foundation, national, whoever, would you like to contribute to this? So it gives them a lot of power in the fundraising side, but also because they can convert these, the liens particularly for home purchase, they can convert them into an asset on their books. So that's actually, that's another way that the money has this sort of ripple effect, amplifying effect. So our fee for services contracts through the general fund, we provide, HomeWise and the Housing Trust are currently under contract via an RFP from 2018 maybe. They provide an array of homebuyer training and counseling services, as well as they work with homeowners. HomeWise provides refinancing, the Housing Trust provides counseling on home equity conversion mortgages, reverse mortgages. But what's important is that for years and years and years, the governing body has made this support for home ownership for the workforce, as well as special needs populations, a big priority. It dovetails a lot with what Rich is doing. It dovetails with the sustainability goals. If we have fewer people commuting into Santa Fe, our air is healthier. The other part, and this is the part that's required by code, is that these two organizations help me administer the inclusionary zoning program. So when I tell a developer, you have to build these 3 houses priced according to this price range, and these 2 agencies are going to provide the income certified home buyers for you who are mortgage ready, because that's a really important piece. We don't want developers not able to sell these houses. So we try to take that marketing burden off of them as an incentive for compliance with the program. We've also, through our general fund, over the last 3 years, very actively funded rental assistance based on a rapid rehousing model, which is low barriers. We don't create a lot of, oh, you have to qualify with or meet 10 really onerous criteria, because that's how the feds do it. And that's helpful if you meet all those criteria, but not so helpful for the average person who just needs help for a short amount of time. CDBG, so we're an entitlement city. We get the funds given to us every year directly from the federal government. The amount of our grant over the last few years has averaged between 600,000 and 700,000. There are 3 national objectives, and any use of funds has to meet one of those. We use our funds exclusively for low mod income benefits. And so how do we use the funds? 20% is taken off the top and used for administration. And I know that sounds like a lot, but it's a lot of work. The Community Development Commission year after year meets to talk about housing priorities, and year after year they, funding priorities, sorry, and year after year they pick housing. So this is based on a 5-year trend, and we're in the process of updating this data, but right now it just kind of gives you a sense of how funds have been distributed historically. So the vast majority for housing activities. We're also allowed to use funds for public facilities, and I feel like we've replaced every single shelter's roof in town, but anyway, so we've done some of that work. Public services are also allowable, but they're capped at 15% of the grant. Affordable Housing Trust Fund, this is the local fund. It's funded through revenues from development. We collect fee and lieu. We collect fractional fee payments from developers. We have city-held liens, so the affordability liens to keep the homes that are sold through our programs affordable. It's the difference between the market value and the subsidized sales price. So, and occasionally people sell them and they can't find another income certified home buyer, so those liens get paid off. And any lands, and a portion of the land sales from TR Contenta, which we haven't had much of recently, but hopefully we can kickstart TR Contenta and get some more funds. So Affordable Housing Trust Fund can serve people up to 120% of AMI, of area median income. I think I didn't mention that. The low mod income benefit from community development block grants is 80% of area median income. So where these two programs overlap, affordable housing trust fund can be used for slightly higher incomes, which can be really, really helpful. The use of the funds, they're listed there. I just want to point out that administrative services and staffing costs are not allowable. So this is really looking at direct financial assistance to an income certified individual or to support the capital costs of affordable housing. Here's a breakdown. This is an estimate based on the recent year. We're looking at some of our trend data, and I just didn't have a chance to get it that updated, but you can kind of see where it goes. A big percentage of it goes to down payment assistance. But we do a lot of home repair and home improvement loans too. So here are just some funding goals, leverage metrics. I want to make this point. Affordable housing trust funds, they're last mile. They're filling funding gaps. This is not seed money. This is not speculative money at all. We also highly value the leverage that these funds, the potential for leverage. So CDBG has to match dollar for dollar. So the organization has to bring another dollar to the table for every dollar of CDBG it's requesting. And for affordable housing trust fund, that's even bigger. It's 1 to 3. And what we have seen over time is that every dollar, for instance, in down payment assistance, $14 is leveraged from the buyer's own resources, but also the value of the privately financed mortgage. For every $1 provided to support the capital costs of development, we're looking at about $10 leveraged in investment, both private equity and debt. So that's a pretty handsome investment result for us. Here's how here's how the emergency funds were used. These are not the emergency funds that the governing body authorized. These were trust funds. Like I said before, we don't make funding allocations based on what's the current balance. We use what was in the fund at the end of the prior fiscal year, but I had just collected a really big check from a developer for a fee in lieu of, and I thought, well, why should this money sit in here for a whole nother year when we know that the need in our community is just going to explode? So we've got 50,000 out for rental assistance, eviction prevention. We've got 60,000 total for helping people make mortgage payments. And with that, I feel like I talked really fast and too much, but I'm happy to share the presentation and happy to answer any follow-up questions days down the road if that's.
Great, thank you very much. And then we will move to the arts, and that will be the last presentation in what has been a very thumbnail sketch of a lot of work that goes on in the city around the nonprofit and safety net and supporting social services across the community. So with that, Pauline, I'll let you have the floor.
Great, thank you so much. Just to let you know, the Arts Commission is a nine-body advisory group, and also to share that recently this fiscal year, July, and then again in January, we were actually made transition from the Arts Commission to an Arts and Culture department. We support arts and culture throughout our community, looking at arts and culture organizations and artists as well. Our main grant program is funded through lodgers tax, and it is to promote arts and culture nonprofit organizations for advertising and marketing and the promotion of events and programming, not only just for tourism, but for residents and visitors alike. Most of our grants, we have 6 categories of grants. 2 of them are larger, global arts marketing and national arts marketing are 2-year cycles, which ended this fiscal year. Our other ones are 1-year cycles. We approximately fund about $900,000, 38 nonprofits in this current fiscal year. It is a request for proposal fee for service. It is a matching grant. We provide technical assistance on how to apply, but additionally, we also look at, how to leverage social media, the best places to market, whether you're looking at the drive market or a fly market, and things like that to promote tourism for that. Our selection committee, we have 1 per category. and they are composed by field experts. So again, we have someone from tourism, we have arts and culture leaders, and other experts in the field who will make recommendations, and that goes to our Arts and Commission Subcommittee, Finance to look at, and then to the Arts Commission for recommendation for approval by the City Council members for the grant over $50,000. Have some stats from fiscal year 18-19, as we don't have any of these yet. And I should probably try to move this. This is based on only 17 organizations, but as you can see, we do have quite a bit of visitors from northern New Mexico. We're looking at our drive market here and also our national and international. And again, this is looking at our larger organizations like the Opera, the O'Keeffe, and some of the arts markets. We are also looking at who our patrons are. And as we know, our patrons are usually here in this area, 25 up to 65 plus. And this is a range of activities that our arts and culture nonprofits provide, whether that's children programming or choral presentations, ballet, different contemporary dance, visual arts, and also historic and cultural heritage. We are really interested in community investment because we know that's what makes Santa Fe so wonderful, is additionally to our blockbusters, but also to our local arts agencies who are providing storytelling. Here in the lower corner is Presente by Little Glow that was sharing stories from the community. Bandstand is something that we also fund. And here's an example of Axel Contemporary doing their pop-ups. So again, we're looking at the creative vitality. We were ranked #1 for the small city, and that was based on these 4 criteria: creative occupations, industry sales, not the number of nonprofits, and we had a creative economy of 102 million. And so when we talk about creative economy, we're looking at not only those supporting those arts and culture organizations and artists, but especially important now in the time of this pandemic and what recovery looks like, but more importantly, how we're going to reimagine what our future looks like. And Culture Connects plays a really big role in how our team at the Arts and Culture Department looks at things. We're looking at centering equity. And as you heard through my other colleagues in their presentations, their grant making and funding processes are also looking at centering equity and access and serving those populations and amplifying those stories, so that ensures that not only our citizens and our visitors have a really great experience, but we're looking at a livable and a viable city. And we're all in this together, and we're looking at ways to expand upon this. We did start the Culture Connects Coalition Artist Relief Fund. Lannan Foundation was super generous and gave us $25,000. We have over 30,000 in pledges, so we matched the Lannan Foundation. And we, in round 1, have awarded 34 artists with relief funding, and we're in round 2 now. We're hoping to have a round 3 as our goal is to reach 100,000. So we'll continue to fundraise in which to do that. But that is short term. It's a stopgap measure. When we look at, and additionally to what our grant program, the cultural investment program, will look like based on next year's budget, how are other ways in which we can fundraise? And that is through partnering with arts organizations so that we're going in on grants collaboratively, not competitively. We're also looking at non-traditional sources like Smart Growth America, which is a transportation. We'll be submitting a grant with Public Works on that and their transportation folks to look at things. So we continue to look and find ways to support our arts and culture community. That's it.
Great. Well, I want to, first of all, just take the prerogative of chair to thank you all for these very detailed presentations. I'm sorry that we don't have, probably we could do an hour or more on each of them. This was very much a thumbnail sketch and the beginning of a conversation. It gives us a broad overview and we can dive into these things. And I know we will be as part of the budget process and as part of, you know, figuring out how we reimagine Santa Fe and the important work that you all do. So I just want to say that, and again, thank you. And then if counselors have questions, we can go there. Counselor Rivera.
Thank you, Madam Chair, and I appreciate the presentations from everybody. I think what I didn't hear was, so in the case of like community services, they receive a significant amount of funding from GRT. I think it was about 166,000 a month. And clearly since probably March, we've been down in GRTs. How's that going to affect us for the remainder of the fiscal year and also into next fiscal year? And I guess that question could be for everybody, and I'm not sure if it can be answered today, but just want us and everyone to start thinking about that. And if community services has an answer for that now, would be good, I think, to start that conversation.
Madam Chair, Councilor Rivera, yes, we're going to be affected in the Children Youth Commission and the Human Services Committee funding. We do have healthy fund balances in those two funds. So it's really going to be a policy decision as to how much of those fund balances we use to go forward based on what we hope and how rapidly we can rebound in the GRT. And I think, it's going to be a balance between funding services that are in many ways needed more than ever at this time, and being able to sustain those. I think what we'll need to do in community services, and it's probably true across the board, is really hustle for outside funding sources. That idea of leveraging what we're doing, and Alex talked about it in a kind of a slightly different way, but we can leverage the funding that we are providing to nonprofits, hopefully with foundations. In the Connect network, we've seen a lot of private and philanthropic donations coming in to the Connect network, which we're excited about. So if we keep those tracks laid, even if we have to reduce overall amounts, we may be able to supplement them with outside sources, and that's really our strategy. But we're going to rely on this body, obviously, the Finance Committee, Finance Director to give us some targets, as well as the Council to help us make those hard decisions.
Yeah, so is it, this is a hard question, I'm sure, but as we start looking at funding, so there's those funding sources that I think are mandatory by ordinance or other means. There's those that have matching funds, as Alexandra talked about. Are we able to separate those from what is mandatory, what we need to do versus what is nice to do?
Madam Chair, Councilor Rivera, in fact, that is what we've all been asked to do recently, and senior staff is to list out what is mandatory, what's what we must do per ordinance or per resolution, and what's quote unquote nice to have. And sometimes those decisions are subjective, what's essential and what's nice to have. And that's going to be something that thankfully we have a very collaborative group, I'd say, of directors, and certainly in my department we have a collaborative group of division directors who are seeking to sort of mutually support what's best for quality of life in the city.
Yeah, Alexandra, I'd like to hear from you on that as well, because and I shouldn't say nice to do or nice to have. Everything you do is important. Everything that I think we heard today is important, but I think we're gonna come into a situation where we're really gonna have to decide what has to be done and what can wait. So Alexandra, with you in housing, big concern of mine. So just want to hear from you on that.
Madam Chair, Councilor Rivera, we are lucky, sort of, on the housing front in that our funds, bulk of our funds are federal, so we have the grant. Now, who knows what's going to happen to the federal budget? We may have down the road, we may get a big cutback, but for at least the immediate future, we should be able to move forward with programming that will help stabilize people's housing conditions. And like I mentioned, our trust funds are based on revenues that were collected from last year's development activity. So we do have a balance of funds that we will also be able to use. I think that the issue of the general fund, that's going to be the one that our budget folks are most concerned about. We do have, by ordinance, I need a couple of those contracts just to help me implement our inclusionary zoning program. I like to think that rental assistance is essential, especially now, but that will be, as Kira mentioned, that will be a policy-making decision, a decision for the governing body to decide.
Thank you. Unfortunately, a difficult decision for us, but thank you for that. And I think that was it for now, Madam Chair. And you know, these are tough times, and I think all your programs are important, super important. I appreciate the presentations from all four of you. You know, clearly we have some difficult decisions ahead, and I'm sure we'll all work together to make sure that we handle this situation together. So thank you.
Thank you, Councilor Rivera. Are there other questions from the committee? Councilor Cassett Sanchez.
Thank you very much, Madam Chair. You know, kind of going off the topic we were just discussing, Kira, I know one thing that you've done that I have found really useful is when you've been discussing homelessness and you've really talked about how much that costs the city. And I think as we look forward with those discussions about how we utilize our now, you know, less than robust, very much less than robust funding, also looking for those opportunities where we can see that balance of savings as well. And so if there are other areas where we can really start to explore that, I'd be really interested, both here at Quality of Life and then as well at Finance, to see what those look like. So, and I think that goes, you know, across the board with all the different programs. Rich, I'd love to hear a little bit more as well about, you know, where have jobs been created, especially as we start to look at how do we punch up our economy, because we are so, with the way that we are financed, we are so intrinsically tied to our economy. You know, with our dependence on GRT, you know, we do have to be looking at the long term there as well. So that's just, you know, what I ask as we start to have those conversations. I really want to be looking at it from that perspective as well, as not just what does this cost, but what else does it save? So I guess that wasn't really a question, more of a request moving forward. I just want to thank you all for this work. You know, this, especially when we get into community services, this is my field. So really, really hits me close to home. And I think that there was kind of like a mourning of like what was lost, of where we were headed, and we were doing all these exciting things. But I really have faith in the staff that we can continue to move forward. So thank you so much for that. That was all.
Thank you. Other questions? Councilor Garcia.
Not necessarily a question, just thank you to Alexandra, Kara, Pauline, Julie, and Rich for your presentations. I really appreciate it. You know, to echo what my colleagues said, we are going to be in a really rough situation soon, and it's going to take innovation. And I'm so grateful that we got some great department leaders like you all to lead us through the next steps, and we will have innovative ideas. So thank you all. Thank you all so much for your presentation.
All right, with that, I think we'll move on to the tail end of our agenda. I know the hour is late. We definitely overscheduled this meeting. I take full responsibility for that. And we'll have opportunity, I know, to visit with you all in a more in-depth way. So again, thank you. And with that, we will go to matters from the committee, if there are matters from the committee. And if there are no matters from the committee, matters from staff.
Yeah, Chair, I would just like to say thank you, and I'm sending out an email now requesting your presentation if you have not already sent it to me, and I'll distribute that out to the committee.
Great. And then matters from the chair. I don't think I have anything except that we will be looking very closely at the budget and how we fund in all of these areas. And these are going to be very tough conversations and tough decisions. So I look forward to those with this information in our back pocket. So thank you. And with that, if there's nothing else, we will adjourn. Thank you all.